on Prakash here again. So we're going to continue the medical astrology here. Now, disclaimer, disclaimer, disclaimer. I am not a doctor, and this is not a medical advice. Okay, important. I am not a doctor. This is not a medical advice. This is based on the experience that I've seen and received from my clients for the past 20 over years now, based on medical related a service or prediction which I've done. All right. So one of it is the diabetes. So I'm going to talk to you about what diabetes is. Obviously, I won't have great depth in knowledge, but a little bit, just a little bit. All right. So a diabetes is a defect in how the sugar, or basically glucose, is converted into energy. Okay, basically it's a process called glucose metabolism. Basically, how glucose is converted into, and glucose is moved in the blood to the body cells. Okay, and that, which of course gives us energy. So again, the process is the sugar in the blood, it needs to be moved and sent to the body cells, and of course from the body cell, that's how we get energy. And that process is basically that metabolism process is called glucose metabolism. Now if there's a problem with that process, then sugar is not moved, it gets stuck, or that sedentary state of glucose can lead us into diabetes. Okay, there are many types of diabetes. Okay, the most common one, the diabetes type 1, which means there isn't any glucose, or I'm sorry, there's no insulin. Now what is this insulin? Insulin is the hormone that is used in the process of moving it, converting the entire glucose metabolism. Without insulin, it's not going to work. Insulin is that special hormone that actually uses to move from sugar in the blood, or glucose in the blood, to the body cells, which creates energy. That is the function of insulin. Now imagine if there's no insulin there, or very less, or to zero. That's what diabetes type 1 is. That sugar is just sitting there, it's not going anywhere. And of course that creates problems, isn't it? That's where diabetes type 1 comes, where they need to inject artificial insulin for the process to work. Second one is diabetes type 2, which is far most common one. I think WHO states it's about, statistics shows about yeah, it's about 500 million. Staggering, yeah, 500 million people are affected. It's a it's concerning. Yeah, it's unnerving to know that there's so many people out there who have diabetes type 2. So that one here is that insulin is there, the pancreas, which is the organ that creates and secretes or releases the insulin. That's the pancreas. So it's sending, yeah, but it's either that it's not sending it properly, there's some problems with the release of the hormones, that insulin, or it's not really enough. It's not really enough. So this does not require usually the case of artificial insulin, but oral medicine, and also changes in lifestyle, diet and stuff like that. Okay, that is kind of a treatment for that. Again, guys, I'm not a doctor, this is not a medical advice, right? And the third is the gestational, when during pregnancy, right, the hormones are all haywire. And so after delivery, sometimes the hormones needs time to get back, and for some people it doesn't. And because of that, the hormone called insulin goes haywire, and such they also have type 2 diabetes. Okay, those mothers, they have that. Again, same kind of treatment, right? Lifestyle changes and oral medication and things like that. All right, so these are the three things about diabetes. So this is, I'm going to talk to you about the type 2 diabetes. Now type 2 diabetes is formed out of three grahas. From my experience, I've seen there are three grahas which are responsible. Number one is Shukra. Shukra, as you know, is karma, personification of your pleasures. And it's superfluous for me to say. I mean, you binge eat, you eat chocolates and whatnot. You just sit in front of the couch, watch TV, and then munching something all the time. You're sedentary, yeah, you don't move. And of course, Shukra is responsible for not only reproductive, but also kidneys. Again, diabetes affect the kidneys as well. So that's one. Second thing is your moon is about your emotions. How you feel also affects. Okay, studies have showed that if you have a general anxiety, or it can be some trauma when you had, or constantly you're melancholic, is you're always sad for whatever reasons, and this maybe bankruptcy or whatever, right? Divorce or a death in the family or whatever the reasons are, that can also cause diabetes as well. So that's one of it. Now the moon is also involved in the process of secreting the insulin. That secretion process, any kind of secretion in any kind of hormones and from any kind of organs, I mean, that secretion is also moon. Okay. Moon is also involved for fluid, water. Now the process I said earlier, right, the glucose metabolism is a process of moving sugar from the blood to the body cells where you get energy, isn't it? That moving process requires water. So fluid dynamics is moon. That's another thing. The last is of course Guru Bhagwan. Guru Bhagwan is obesity. That's pretty much it's an epidemic just like diabetes or obesity. Yeah. So obesity is one of it. And general any kind of metabolism process is also Guru Bhagavan. Okay. And what else? Especially if Guru is afflicted in the watery signs, which is which is Kadagam, Vrichigam, and also Meena. If it's there, then that's it makes it even worse. Let's say if Shukra is in Kanni, for example, right? It becomes debilitated. So that's another reason. So there are different reasons, and it's very complex, right? So well, for the remedies, it's best to have it checked. It's best to have it. If you want, you can always connect with me. I can have it done for a small fee. But you can also do general appeasing. You can also appease Shukra, Guru, and also Chandran. You can do that too, right? And I've seen over the years improvement again and again and again. Not a medical advice. I'm not a doctor. All right. So I hope this helps or information provides you some clarity on how astrology actually does. Quote unquote fixing, yeah, quote unquote remedies or treatments. So yep, I'll see you on the next one. Thank you.